All right, now we're going to be looking at the next two. So the first one that we're going to look at is anencephaly. I could be saying it wrong, who cares? So basically, anencephaly. So an means no or without. So an enceph or cephal, that's part of the head. So it's going to be with or no part of the head. So this is the failure of neural tubes to close. So they're born without parts of the brain and or skull. So risk factors are decreased, like you don't have enough folic acid. Whenever you're pregnant and you weren't taking the folic acid that you were supposed to be taking, it's a folic acid deficiency. That can cause this. And genetics. So signs and symptoms is going to be a visible cranial defect. You're going to have obvious signs. You're going to look at the head and see that there's something wrong. So they'll have a flattened head. Exposed brain tissue, missing parts of the skull and scalp or cap. Because of this, they're going to be incompatible with life. So your treatment and management is going to be supportive care, end-of-life planning, and emotional support for families. You want to be able to give them their space, but also be there when they need it, and allow them to cherish their child. Because they can't live with that. Now we're going to look at microcephaly. So micro, small, cephal, head. So it's a small head circumference due to abnormal brain development. So in order to be considered microcephalic, you have to be more than 3 deviations below the mean for the age and sex. So kind of according to that plot and growth chart. So some risk factors for this are going to be genetic disorders, infections. Infections is going to be your main thing here. So the main ones that she listed were going to be Zika, the Zika virus, and then in the book they did mention rubella and toxoplasmosis, and then malnutrition. So infections, these are going to be more important, and then malnutrition is if it's acquired. So you can be like born with a small head, but malnutrition can be a problem that causes it later. So some signs and symptoms, obviously it's a small head, and then delayed motor function and speech, and then cognitive impairment. So whenever the head is small like that, it's not giving enough space for the brain because it has abnormal brain development. So the brain is small as well, so they're not going to be able to do these typical things that we usually do. So the treatment and management for this is going to be support. You want to be there to support the family. And you can do that by giving early intervention programs like physical therapy, occupational therapy, and speech therapy. Those are going to be your 3 main things. And you want to give family education, give them options to social workers, support groups. You just want to be there to support the family. So on anencephaly, the main thing that you're going to want to focus on is the folic acid deficiency and end-of-life planning. And then over here for the microcephaly, the one that you're going to want to focus on here is going to be the Zika virus, malnutrition, and then the support part. That's going to be your main focus is on those 2.